Hello everyone, how's it going? You know, with so many people dealing with obesity, the medication Ozempic has become extremely popular. Well, what is Ozempic? Are there any side effects? And is it recommended for everyone who wants to lose weight? Well, if that sounds interesting to you, keep watching. The CDC estimates that 42% of Americans are living with obesity. We know obesity can lead to chronic disease like heart disease, kidney disease, and even sleep apnea. Most people would agree that losing weight is definitely not an easy thing to do. We also recognize that being overweight can really have a negative effect on our mental and our physical health. So it's no wonder that Ozempic has become so popular. Our research has shown that this medication has helped people lose 10 to 15% of their body weight. But is it really something that would be good for everyone? And can it help curb other addictive behaviors? Well, we'll talk about that a little bit later on in the video. So what is Ozempic? Well, the generic name is semaglutide. It was approved as for use as a diabetes medication in 2017. It turned out not only to be highly effective in treating diabetes, but also obesity. So in 2021, the FDA approved Wegovy as an anti-obesity medication. And that is the same drug as Ozempic, but it's typically prescribed at a higher dose. Well, how does it work? Well, once a week, you would give yourself an injection in the thigh, abdomen, or upper arm. It comes with a medical device, a very tiny needle. It makes it very easy to do. This medication actually mimics a hormone that plays a role in appetite and digestion. It slows the movement of food out of your stomach, and it targets areas of the brain that help to regulate appetite and fullness. It can even reduce cravings for certain foods like salty snacks and sweets. So since it can curb your appetite and you feel full, you actually wind up eating less calories. In fact, most people on the medication eat only 2/3 of what they used to eat before the medication. Now, before we discuss the side effects and if this is something that would be good for everyone, I'd like to remind you to please like and subscribe if you're enjoying today's video. Also, a reminder to always check out the links below in the description box. There you can find more information on this topic. And if you've tried one of these medications, feel free to leave a comment below, just if you'd like to share how that worked for you. So what are some of the side effects? Well, the most common would be bloating, nausea, vomiting, constipation, and diarrhea. Some people also experience abdominal pain, breath odor, burping. Most of these symptoms are experienced in the beginning of taking the medication, and they usually tend to ease off. Your doctor will try to minimize the symptoms for you. They'll usually start you on a lower dosage, and then they just gradually will increase it. But the tolerance for the medication has varied widely with people. Some people's bodies do tend to adjust with no problems. Other people, they just can't even bear the symptoms. They don't seem to be improving, so they have to stop the medication. Well, what about Ozempic face? I know that it's not an official side effect, but it is something that concerns many people. Well, from what I've read, the medication doesn't specifically cause weight loss in the face, but whenever someone loses a significant amount of weight in a short amount of time, they may experience excess skin accumulation, especially in the face, the arms, and the abdomen. So, especially as we get older, our skin has a hard time adjusting to large changes to subcutaneous fat. This may be less of a problem if the weight loss is done in a gradual and controlled way. Another concern that people have is muscle loss and lower bone density. And that could be a definite concern for older adults. But getting enough protein in your diet and regularly engaging in weight-bearing exercises may help with this. Now, more serious but rare, people have concerns because studies show increased risk of stomach paralysis, pancreatitis, and bowel obstructions. The medication could possibly also cause thyroid tumors, changes in vision, low blood sugar, kidney problems, a serious allergic reaction, which could happen with any medication, or gallbladder problems. So who shouldn't take this medication? Well, if you have a history of pancreatitis, if you have type 1 diabetes, if you're under age 18, if you're pregnant or breastfeeding, if you have diabetic retinopathy, if you've had problems with your pancreas or kidneys, if you have a personal or family history of medullary thyroid cancer, if you have multiple endocrine neoplasia too. it's not recommended to take this medication. So as highly effective as the medication is, it isn't for something that would work for everyone. Apparently, people are able to get these medications online at virtual clinics. However, it's a lot safer to make sure you work with your doctor to make sure this medication would be safe for you, along with the other medications you take, perhaps supplements and other health problems that you may have. In order for your doctor to prescribe the medication, you have to have a BMI of 30 or higher, or a BMI over 27 and have an associated condition. So you may have hypertension, type 2 diabetes, or high cholesterol. Now, some people will make the mistake of thinking they can take this medication for a short time and then just go off of the medication. Unfortunately, when people go off the medication, they gain the weight back. So this is not really meant to be for short-term weight loss or for someone who needs to lose a few pounds. It's actually designed for people dealing with the disease of obesity. And most people will need to be on this medication long-term. And that's really something to consider because the medication is quite expensive, and unfortunately most insurances do not cover it. So you might want to look in to see if you'd be eligible for a savings card or some kind of a coupon or discount from the manufacturer. So this medication shouldn't be viewed as a standalone solution. When people are on this medication, their weight generally plateaus around 3 to 6 months. So lifestyle changes are very important in order to maintain a healthy weight. What I thought was a really interesting side effect is something I mentioned earlier, was can it help with other addictive behaviors? Well, doctors say that patients are reporting a reduced interest in alcohol. They think it may be possibly because Ozempic has an effect not only on the gut, but on the brain. So the drug may reduce the rewarding effects of alcohol. It has been reported that it's helped people with other addictions. It's actually reduced their cravings for other substances of abuse. However, the reduced interest in alcohol has been the most commonly reported one. So the bottom line is that Ozempic and other medications using semaglutide are highly effective for helping people with weight loss, but it may not be something that's going to work for everyone. It is best if you are using the medication to be under the care of a physician so that you can manage potential side effects and other health risks. People are definitely highly cautioned against using generics of this medication that are not FDA approved. There have been some adverse effects that have been reported. So losing weight can bring us many benefits. We can help improve our blood pressure, our cholesterol, our energy, but we definitely want to try to make sure that we're losing weight in a safe and healthy way. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.